All right, now we're going to go ahead and inspect your ears. And first I'm just going to start by looking at the outer structure, assessing for symmetry. I'm going to check for any redness, drainage, swelling, any signs of infection or inflammation. And then we're going to go ahead and do the whisper test, and this is just going to check your hearing. So what I'm going to have the patient do is occlude one ear, and I'm going to whisper a common 2-syllable word or phrase and have her repeat that to me, and then we'll repeat that in the other ear. And it'll just be something simple. So baseball. Good job. And then the other ear.
Mango.
Perfect. Okay, so normally, I'm going to go ahead and use my otoscope, and I'm going to assess the inside of the ear, and it has a light source on it. So I would pull the pinna up and back and insert the speculum into the ear, and I'm looking at the internal canal for any redness. I'm going to assess the tympanic membrane, and it should be a nice pearly white color. There shouldn't be any redness or signs of like a bulging eardrum or anything like that. And I am going to also look at the structures inside the tympanic membrane to make sure that all the bony prominences are there, and I would assess the light reflex. So I'm going to go ahead and assess the other ear really fast by pulling the pinna up and back and inserting the speculum, and I would use the largest speculum I could find. And her tympanic membrane looks great and normal. It's not red at all, so nice pearly white color. And now I'm going to go ahead and inspect the nose, and I'm just going to assess the external structure. I'm going to make sure that it looks straight, there's no deviation. I'm going to go ahead and have her tilt her head back so that way I can see up her nose in a comfortable way. I'm going to use my light source again to look up her nose. So I'm just going to push it up with the tip of my finger and insert, well, I don't even really have to insert it, but just look to make sure that there's no redness. And I can make sure that I can see her septum, her mucosa, make sure that it's red or pink and moist. And I would also assess the turbinates and looking for any kind of polyps or any septal deviation, which she doesn't have. So now I'm going to go ahead and move on to the mouth, and I'm just going to look at the external structure, looking for any kind of lesions or sores, check for any extra dryness. I'm going to go ahead and have her open her mouth. I'm going to assess the inside of her mouth, looking at the teeth, the tongue, the inside of her cheeks. Go ahead and lift your tongue for me. Looking at the floor of the mouth for any kind of sores. It looks pink, warm, or not warm, pink, moist. I'm going to have her go ahead and look at the back of her throat and say, ah. Got it. I'm looking at her tonsils and her uvula, making sure it's midline. And her tonsils are about a 1+ because they're occupying less than 25% of her oral cavity. And I'm going to go ahead and next assess the neck. So I'll start by palpating her lymph nodes, looking for any tenderness or swelling. Her lymph nodes should be small and movable. They shouldn't be firm or fixed. I'm going all the way up to the chin, and then I'll work my way down the neck, just continuing to feel any tenderness at all. Okay, perfect. And I'll go ahead and go down the neck too, just keeping to look for any kind of masses. I'll assess the trachea and make sure that it's midline, which it is. And then I'm going to go ahead and have you turn your head that way, and I'm just going to continue to palpate down the neck. Good. And the back side. And then look the other way for me. Perfect. And then I'm also going to look at this time for any jugular vein distension, which she doesn't have. Okay, perfect. And then I'm going to go ahead and palpate the trachea, and I'm going to displace it from side to side just to make sure that it is midline. And at this time I can go ahead and assess, after I find it, her thyroid, and move it side to side as well. And then I'm going to go ahead and have you tuck your chin and then roll your head around. Perfect. And this is assessing her range of motion, and go the other way. Great. And then I'm going to go ahead and have you push against my hand. Good. And again. Perfect. So just making sure that her muscle strength in her head is equal on both sides. And that's it.